Good morning. I think that it's time to get started for the second day. I want to thank you all for being here and not for not having despaired based on what we discussed yesterday. Our missing data for the second day is probably very minimal. I see almost everybody still persevering in the effort of trying to come up with some solutions. I think we had 4 very interesting sessions focusing on different aspects of the problem at hand, ranging from reproducibility and data sharing and openness to evaluation, peer review, and methods. And we will have another session this morning on education that pretty much touches on all 4 of them. And there were tons of very interesting ideas in the breakout sessions that I understand, talking with people in various teams, that there was a lot of difficulty to try to streamline down to just 5 for each team and try to prioritize them. So I think that there will be plenty of material to discuss later on today. I just want to share a couple of thoughts based on what I heard, but also what interactions I had with several of you. I think that this is a vast area. It covers practically all of science. So interdisciplinarity is the big strength. At the same time, there's some unevenness across different scientific disciplines on how they do things. And sometimes there may be even a perception of threat that, things are changing and someone is trying to impose change on us from an external environment. And who are they? Are they the sheriffs or the ultra-regulators of science? And I think that this is something that we definitely need to avoid. All of us are scientists and engaged and interested in science and making sure that we get the best of what we try to do. And I think that the efforts that we put together will be most successful if also we manage to engage scientists very widely. So if we make this a grassroots movement of people who really want to improve the way things are done in their discipline, not because it's some peculiar or weird extravaganza or some checklist that needs to be checked among thousands that are out there, but because it will lead them to more efficient processes, to getting more reliable results, to becoming more famous and getting more grants perhaps. So that it will really help them to do a better job in what they really want to do. Then the other tension that I realized was that there's probably 2 extreme schools and everything in the middle. One being kind of an iconoclastic approach that everything that we do is wrong, and let's get rid of peer review, let's get rid of funding processes, let's get rid of academic promotion processes, let's get rid of papers, publications, citations, anything. And another view, which is that what is the evidence for replacing any of those? Can we improve on those? And personally, I'm very much committed to that second aspect of trying to improve processes, not abolish processes. If we have evidence that something is completely malfunctional and we have to replace it with something that doesn't yet exist, but we need to think about it, I'm happy to put that proposal forth, but I would not do that unless we have some really good evidence that something is entirely not malfunctioning and we cannot really fix it. So, instead of no peer review, probably we have to think about we need more peer review or better peer review, better quality and more effective peer review. Instead of no metrics, I hate to say no metrics, we need more metrics and better metrics and more accurate metrics that capture what we're really interested in. So there's always that tension when these discussions appear, and I'm sure that this will arise again and again, but these are just some thoughts that I wanted to share at the beginning of today. And other than that, I think that Steve wanted to also share some thoughts on how we move forward for the rest of the day, in particular for the second part, which is putting things together and moving forward with some nice projects and ideas.
Thanks, John. That was a great sort of synthesis from yesterday and where we're going to go forward. So I just wanted to give you a sense, a heads up of what's coming. The next session, of course, is a session on reaching out to other audiences, the consumers, the scientists, and other participants and people impacted by this process, the media. And after that, we're going to have our final go at the outcomes of the breakout groups. And what we're going to do is, and this is a heads up for those few representatives of the group who don't know, is we'll get a sort of little bit of a report out from the group in terms of what the group struggled with and how they were generally thinking and how they came up with the proposals that they did. We're not going to go through every proposal, but then what we will do is highlight the proposals that were on the back that you all saw that got the highest number of votes. And some of these were very specific in terms of it's very clear how we would go forward from there. Others are still sort of vague ideas, motivations, high-minded thoughts. And one of the goals from this conference is to take away a set of actionable activities, whether they be research groups or policy development groups or crusades or whatever. And so what we'd like to do is use the entire group to take the most highly rated ideas, proposals, actions, and think about what it takes to take the next step. So refine them yet further. That hour and a half, as everybody experienced, was not nearly enough to really crystallize these things into things that we would do. So trying to think about how we would take them forward and how we would organize ourselves or our colleagues or with or without metrics help to do that. That will be the goal of the final hour and a half, and then we will release you to the 70-degree day. We engineered this for you. I don't know if God was smiling on us because he thought our mission was so noble, or he was trying to entice us away from doing too much, but I'm going to say it's the first. So anyway, that's the picture for the day. And I'll just invite up Dave Magnus, who's one of our affiliate faculty, head of the Center for Biomedical Ethics here, and a general polymath in all things research and ethics, and also very involved in issues related to consumer engagement. So, David.
Thank you. The rest of the panel is coming up. I'll make my introductory comments very, very brief. As Steve mentioned, this is a different panel than what we've had up till now, really talking about innovative attempts to engage broader audiences, public, patients, policy, and finding ways to improve the quality of research. Just to save time, I'm going to go through in order of our talks, of our speakers. Annette Barr-Cohen will be our first speaker. She's has worked in public health, specifically women's health, for over 30 years. She's the executive director of the Center for Advocacy Training at the National Breast Cancer Coalition, including Project LEAD, which is a 5-day intensive course on science and advocacy. She's a member of the Patient Advisory Council of the Clinical Trials Transformation Initiative and a frequent speaker on patient engagement and advocate involvement in clinical research. Today, she'll be drawing on that experience to discuss the role of advocates in ensuring that better, more valuable research takes place. Our second speaker will be Jonathan Kimmelman. He is a recovering hard scientist with a PhD in molecular biophysics and biochemistry, so somewhat recovering, right? He's also associate professor in the Biomedical Ethics Unit, Social Studies of Medicine at McGill University. His research centers on ethical and policy dimensions of translational research, including design and reporting in preclinical research, non-reporting and redundancy in drug trials, and policies driving efficient research design. He is very well known for his work on gene transfer and stem cell research, and he chairs the ethics committee of the International Society for Stem Cell Research. Today, he will be discussing ways of mitigating threats to scientific validity through development of policies and innovative conceptual tools. Gary Schwitzer has been the publisher of healthnewsreview.org since 2006, and adjunct associate professor in the University of Minnesota School of Public Health. healthnewsreview.org that he founded, reviews news stories and news releases that make claims of efficacy about treatments, tests, products, or procedures. A noted leader in healthcare journalism, his efforts have been recognized by a Knight Batten Award for Innovations in Journalism, a Mirror Award for Media Industry Reporting from the S.I. Newhouse School of Syracuse University, and the American Medical Writers Association honored him for, quote, preeminent contributions to medical communication. He will share with us his experience and how to create a better, more evidence-based science journalism. And then finally, Tracy Brown has been the director of Sense About Science since 2002. During her time at Sense About Science, Tracy's led successful initiatives and campaigns to promote and protect sound science and evidence in public life. The current focus of that work is all trials, winning public support for the idea that all trials, past and present, should be registered and reported. She's written papers, periodicals, and books on accountability for evidence, including In the Interest of Safety, 2013, republished forthcoming in 2016, as Playing by the Rules. She sits on the advisory board of Open Trials, on the steering group of the Food Standard Agency's Our Food Future project, and she was a commissioner on the UK Drug Policy Commission from 2009 to 2012. Today, she will discuss her work with Sense About Science.